This is Dr. Harika Surapaneni, Director, Dr. Harika ENT Care Hospitals, Hyderabad. So today we are going to talk about adenoids and tonsils, how they are different from each other. So let us see what is adenoid and what is tonsil first. So adenoid and tonsil, they both are part of immune system. Okay, immune system is nothing but the protective mechanism of the body. So these both the adenoids and tonsils are the lymphoid tissues in the body. They help in engulfing the bacteria or the viruses surrounding them, which is causing the infection, and they kill them. This is the function of a lymphoid tissue. So that is how it helps in the immune system. So they are very active in the childhood, and as and when the person grows, the immunity develops within the blood, and the function of these tissues come down. So, but how are they different from each other? So why are they not the same? So tonsils are found on either side of the tongue. When we open the mouth and see inside the mouth, on either side of the tongue which we see are the tonsils. But adenoids are not seen outside. They are present right behind the nose in the area called as nasopharynx. This is the airway. If we see, this is the nose and this is the airway. So behind the nose we see these adenoids. So whenever a pathogen enters from the nose and infects the nasal cavity, these adenoids pick up those pathogens and kill them. So that is how it protects the nasal cavity. So that is how it helps in immunity. So the position defines whether the lymphoid tissue is an adenoid or a tonsil. So coming to the symptoms, when these adenoids and tonsils get infected, how a person gets affected. So when there is a adenoid infection, it is called as adenoiditis. When it is infected, the child or an adult will not be able to breathe well, because when the adenoid is infected, it swells in size and will be blocking the airway. So they won't be able to breathe from the nose and will be forced to open their mouth and breathe from their mouth. So especially this condition is seen in children, and so these children will be snoring a lot and will be having mouth breathing. During the day or in the night, they'll be breathing through their mouth. So when the tonsils are infected on the other side, the tonsils on either side of the tongue, when they get infected, they'll have lot of throat pain. So these are also very common in children, but even we see these tonsil infections in adults also. So when they have these infected food or chilled water or chilled items, anything, when they ingest something like this, so they get infected, and these tonsils will enlarge in size and they'll have lot of throat pain. So how do we treat these adenoids and tonsils when they get infected? So when they have tonsil or adenoid infection, if these episodes are just 1 or 2 episodes in a year, then these tonsils, there is no need to get them removed. We can just give an antibiotic and a painkiller and required amount of medication and get them cured. But when these episodes keep recurring in a year, if say suppose 4 to 5 episodes a year, then these tonsils should be operated and removed. Coming to adenoids, when the child is snoring a lot, when the child is continuously snoring and they are having difficulty in breathing and mouth breathing every time, if these symptoms are there for a long period of time, then these adenoids have to be removed. This surgery is called as adenoidectomy.